Hi, this is Amy R and I'm about ready to do my newborn assessment. So I've come in and I'm just going to do an overall appearance on the baby. Hand hygiene, just making sure that just overall the baby looks good. Making sure that there's no cyanosis around the mouth. Cyanosis around the hands and the feet is a completely normal thing, but checking it at her nasals, making sure that they're not flaring, because if they were, that could indicate that she's having some respiratory distress. Just taking a look at her color. So at my first glance, overall appearance, baby looks good. So I'm just going to go ahead and unwrap you. Hi, sweetheart. Unwrap baby here. Hi. And we want to do a head to toe assessment on a baby when they're most calm, that they're either sleeping or just very calm, because we want to get the most accurate readings for our assessment as possible. So we're going to go ahead and take your hat off. And I'm going to go ahead and get all of baby's vitals. But first, while baby is, I could even keep baby half covered, I'm taking a look at baby's respirations, looking for any retractions in the tummy. That would be the sunken in ribs, and looks like she's distressed when she's breathing, and as of first appearance she doesn't seem to be. So I'm just going to count her respirations, making sure that her respirations are good. So just count those for a full minute. And she's about at the 35, 34, which is totally normal because it's about 30 to 60 for respirations. And once I've done that, then I can go ahead and do the rest of my assessment on her. I'm going to listen to her heart and lungs. Right by the nipple here. Perfect. And her heart rate is about 110, which normal range is about 110 to 160. So I'm just taking a listen here. Listening to the sides, where I could also be able to tell best that there was any wheezing or cracking. I'm going to listen to all 4 quadrants of the baby's tummy. Everything looks great. I'm going to go ahead and get myself a blood pressure reading, which they have these nice little cuffs here. We would do a blood pressure reading. And also the last thing that we would do is get a temperature on her, under her axillary. Perfect. And it's about 97 degrees. So we're looking good. So vitals are all done. I've done an overall appearance. Now I'm just going to start from head to toe. I'm going to go ahead and lift up baby, and I'm taking a look at baby's fontanelles. Her anterior fontanelle should be a diamond shaped, making sure that it's all intact here, that there's no protruding of fontanelles. And I'll follow that back to the posterior fontanelle and make sure that that's exact same, that it's flat, it's not got any ridges or anything, so she's got a diamond shape. Fontanelles, overall the general appearance of the head looks good, everything's symmetric. I'm taking a look at the baby's face, making sure that the coloring is good, everything's symmetric, the baby's cheeks look good. I look at the eyes, and I'm going to take the outer canthus of the eye to the tip of the ear here, and if they're even, that's a great sign. I'm looking at her nose again to make sure that there's no flaring of the nose, and then I can also push down on baby's nose here, checking for jaundice. If I were to push down and any of the yellow coloring would be there, that could be an indication of jaundice. So I'm looking at baby's eyes, also making sure the sclera is white. Sclera looks good. There's no red in her eyes. The ears look great. They can fast recoil. They go back. They're not bending outwards at all. So those look good. I'm also going to take a look in baby's mouth here. And we're just going to open up here. I'm checking the top and the bottom palates, looking for any pearls in her mouth. Everything looks good. Redness, cracking, but she looks great. I'm also just going to rub the side of her face, and that's her rooting reflex. And that's all intact there. So I'm also moving my way down, checking out her chest. Babies have a barrel chest, so that's completely normal. Once the clothing and the blankets are off, I'm looking at the chest, it's barrel. Working my way down, like I said, the retractions, there are no retractions. Sometimes the breast can be engorged slightly, and that's totally normal. Taking a look at her brachial pulses, everything feels the exact same, equal on both sides. She has 10 fingers. I'll put my finger inside of her palm here and have her squeeze, and she'll automatically squeeze, and that's her plantar reflex, and that's great. I'm also taking a look at her arms here, and if I pull up on her, she should be able to hold herself. She's strong enough to hold herself, and that's great. Also taking her arms and letting them go, and if she just jolts, that's also another reflex that we're looking for in her, and that's also great. I'm looking at her umbilical cord, making sure that it's dry, it's not red, it's not oozing or draining, and it's not bloody, so that looks good. So I'm just gonna throw some gloves on here, and we're working our way down on baby. While I've got baby in this position, I'm just gonna check her hips. Keeping my finger on the hips, and I'm listening or feeling for any cracking, and there is nothing going on there, so baby looks good. Temperature of legs are equal, they're good. There's rotating her ankles around, that all looks good. I'm doing the Babinski, and her toes should flex, and that looks good. I'm just going to unfasten her diaper here. Because she's a female, I'm looking for any excess discharge, or sometimes they have a pseudo menstruation, and she does not have either or. But if this was a male, I would be making sure that the tip of the penis had the urethral opening, and that it was in the middle and not off to the side. I'd also be checking both testicles, working my way down, make sure that both scrotum have testicles inside of them, and they do. I'm looking at her diaper, making sure that if there was meconium, I'd make sure to put a clean diaper on, but meconium is their first poop, so that's what we're looking for. She doesn't have any pseudomenstruation, she doesn't have any excess discharge, so she's looking good. Put her diaper back on here. Checking her capillary refill on her toes as well. Take the gloves off here. Capillary refill on the toes looks great. So we've worked our way around head to toe. I'm also going to flip baby over here. And I'm looking at the back of her neck here if there's any redness spots or anything like that. It could be meaning that there's a rash that'll go away on its own. I'm going to rub my finger down her spine, making sure that it's all intact and it's straight. If I pull down here on the diaper, I'm looking for any sacral dimples, and that could be an indication that she could have spina bifida, and we don't have any of that. Her gluteus is equal. She looks good there. I'm also going to take a look at the back of her legs. The inside folds are equal, and it is on her. So she looks good. Base of spine, everything looks good on her. So I'm just going to turn her right back around here. I've done the whole head to toe assessment on her. I'm going to make sure that I cover her back up. Her reflexes are great. Her coloring is great. Her spinal cord's intact. Her genitals are intact. So we've done that whole overall. Vitals are good. I'm going to make sure to wrap her up in 2 blankets again to keep her temperature, and also have her hat back on here. And baby is good to go.